Heel spurs, what are they and how do we treat them? So a heel spur is basically a bony growth that grows out from the heel bone or the calcaneus, and it usually grows off the medial calcaneal tubercle. So it's this little lump that we can see just here. And now there's a lot of structures that attach to that lump. So if we imagine that this pen is the plantar fascia, there's also some muscles that attach onto this on the medial tubercle as well, but it's mainly the plantar fascia. So what happens is we get a little bony growth outgrows from the heel here, hence the name heel spur. It's a spur of bone, and where the plantar fascia actually attaches into helps to draw this out. Now the plantar fascia attaches into the bone. Now we have to imagine that this bone has got a skin around the bone, and it's called the periosteum. And the periosteum is attached to the bone by Sharpie's fibers, and the Sharpie's fibers attach into the bone. So the plantar fascia, if your arch collapses and there's more tension pulling this way, you can imagine it's like a thread pulling out from the skin around the bone gets pulled out, and then the bone beneath it gets aggravated and it basically grows out to fill the void where the little bit of skin gets pulled away. So it grows out in this sharp sort of needle-like spur that grows off the heel bone or the calcaneus. Now, when we look at these on x-ray, they look quite sharp, like a needle sticking out of the heel. But if we actually think about it, if we turn the heel up this way, it's not a sharp needle like the pen here. It's more like a ledge of bone that sits off the heel. Heel spurs aren't always painful. If we x-ray the entire population, we'd find a good proportion of people that have heel spurs from traction in this plantar fascia that aren't painful at all. So it's not always 100% diagnostic of what your heel pain is, but it is, if we look at it like a symptom of, it's one thing in the piece of the puzzle that might cause your heel pain. So how do we treat heel spurs in the clinic? We usually don't actually try and remove the heel spur or treat the heel spur. This is rarely needed. What we try and do is we treat the pain associated with the traction in that plantar fascia. So anything that causes your foot to roll in will help to aggravate the heel spur. Anything that puts tension in the plantar fascia will also help to aggravate the plantar fascia, the heel spur rather. So we look at doing things like support the arches with soft orthotic insoles to help to cushion the heel. We like to cushion the heel because the spur site can become quite painful. We try to elevate the arch because this takes the tension out of the plantar fascia and it won't pull on the heel so much. We also stretch off the calf muscle. So if we have a very tight calf muscle, what can happen is this can actually force our foot to pronate more and cause more pressure in the plantar fascia or any of the plantar structures that attach into this medial calcaneal tubercle. So stretching off the calves and massaging the calves and dry needling the calves will also help. We also look to use a good work shoe or work boot. So we have something that's got a little heel raise on it, so it takes some of the tension off of the calf muscle. It's got a soft midsole, which will help to cushion underneath the heel. We also use an orthotic innersole in our work boots, so this helps to support the foot and take the pressure off the plantar fascia. So anything that we can do to aim to stop the foot from pronating, release the calf tension, will usually help the pain associated with the heel spur. If you're having heel spurs, what we usually recommend is warm up for work like you would if you're going for a run. So we stretch out the calf muscles. We also use good shoes for work because work's one of the activities where we do it lots of hours a day. So if we're on our feet for a long time or a long distance, we need to support and cushion our feet. So all of these things will help with heel spurs. If you're still having problems, we recommend obviously getting seen by a podiatrist. Get checked out, get an x-ray and get a proper diagnosis and see what the actual diagnosis of your heel pain is. If there's anything more we can do to help, or if you have any questions, please comment below. Thanks. If you enjoyed this video, please like, comment and subscribe. It's really simple to do and it really does help out our channel. If you need more information on the topics discussed, you can find some links in the description where they'll take you to our website where we can discuss this in a little bit more detail. If you have a specific question that you'd like answered, please comment in the comment section below and we'll do our best to make a video to address your question. Thank you all for watching and we'll see you next time.